So I'm Dr. Matt Brengman, and let's just talk a little bit about weight loss when your doctor said you need to lose weight. That's not always so helpful sometimes, and it helps to put it in perspective. When people are overweight and they need to lose weight for a certain medical condition, whether that's a joint replacement or a kidney transplant or altered kidney function or even heart failure, it's easy to say it. It's hard to do it, right? Everybody should give dietary therapy a chance, right? Dietary therapy is easy, it's safe. We have to buy food every day anyway, so it works within our budgetary constraints, generally speaking. But it has some limited effectiveness, so we have to be realistic about the intervention. The most important thing to think about when you're embarking on a diet to reach a certain goal is not what if I make it. We know what's going to happen if you make it, but what am I going to do if I don't make it? Because sometimes people's goals are quite a bit different than the reality of dieting. The reality of dieting is people can lose about 5% of their body weight reliably. 5% is some, but it's not that much. For somebody who's 200 pounds, that's 10 pounds. For somebody who's 300 pounds, that's 15 pounds. So we have to be realistic. When you're doing that dietary therapy, it's important to understand the next step and what would be required if you were to go to the next step. Just like if you were planning to go on vacation, you've got to gas up the car and rent the place and buy your airline ticket, etc. When you start a diet in preparation for having your knee replaced, you want to make sure you check all the boxes. Make sure that your diet is well managed by a physician, that you're being seen on a monthly basis, that your weight's being checked, that you get the dietary information from a dietitian that you need. You want to put your best foot forward, get the information you need so you can be successful. And then if it's not enough, you want to consult a specialist who knows what the next step for you is, how to get you to your goal.